Your mother told you to wash your hands, didn't she? When you came in from outside, she told you to wash your hands.
First thing she would say, wash your hands from coming outside.
What, no hand sanitizer?
And if you're getting off the school bus, take them school clothes off. Take the school clothes off and wash your hands. I remember that.
There it is. I'm resting my case right there. So these universal precautions upon which we have entered into right now that we're supposedly practicing right now, are some kids really getting it? Are they really getting it? You know, do they need visuals to wash their hands? Do they, you know, you would think that would register, right? Yep. Clean your hands, da-da-da. I was a guy who, I think I learned this from Don King. I always washed my hands before I went to the bathroom. Mm-hmm. Because I noticed what's inside of my underwear was clean, and my underwear was clean too. I knew that I done washed already. It's the shaking hands with other people and all of that stuff and whatnot. So I washed my hands first and then went to the bathroom, you know, and I could walk out after that, unless, of course, it was one of those situations that got messy, you know, and some people didn't understand that. No, you wash your hands before you go, not afterwards, if you're taking care of yourself properly. And some young people would never understand that. They know that somebody told you to wash your hands when you finish with the bathroom.
But never to teach you to wash your hands before. And always keep yourself clean.
Never. And you just shook hands with you don't know who. You're hugging on, giving five to, playing, beating your hands on the desk, grabbing this, grabbing that, all of that and everything. And then you go in the bathroom and grab yourself. Mm. See? So methods of teaching and how people receive them, again, it brings us back to why now that some of these young people are asymptomatic in regards to this whole COVID thing. They don't, you know, they're not going to bother to get tested. They don't. I'm not sneezing. I ain't out of breath. I ain't, okay. And this is why they can't fathom being carriers. This is why they can't fathom being a carrier of something so deadly. Oh, not me. I'm all right.
I ain't sick. I tell people all the time, I ain't sick. I ain't feeling sick.
Yeah.
And people thought I was crazy when I went to go get a test, and I wasn't feeling any symptoms. But I live with my grandparents, and my grandmother has a bad cough from recovering from breast cancer years ago. So I have to be conscious of certain things. So I went and got myself a test, came back negative, and I told my friends, I'm like, look, man, if y'all been moving around doing things, being outside, you know, still out hanging out, go at least get a test so you can know what your status is. So you know you're not out here just passing COVID-19 from house to house, from family to family member.
To your grandmother, your own grandmother, and that sort of thing. And so the teaching, you know, it comes back into how they receive that. Going back to your point, how do they receive learning? Is it, okay, so now do we have to start doing kiddie illustrations, washing your hands, using hand sanitizer? Don't forget this. And do we have to go back? Do we have to, because...
Or even, Brother Wes, even a visual explaining how the virus could actually spread. I can go to this friend's house, hang out. We can high five, shake hands like we normally do, right? Because we forgot to dap up and keep our masks on. Mm-hmm. So I'm shaking his hand. He coughed in his hand 2 minutes ago. I took my hand, rubbed it on my face, walked outside. I went to my grandmother's house. I had a conversation at the dinner table with her and my granddad. And then, boom, they have it.
Yeah,
seriously, just showing people a visual how. And I heard this particular virus, which is COVID-19, it's spreading the fastest out of any other virus.
Mm-hmm. Mm-hmm. And they had an illustration. Going back to my days, about 90, from 95 to about 2000, about 90. Yeah.
Oh boy, I was born in 96. Jeez.
Okay, and I was working in the HIV field. And I remember they had a piece. I remember the 55411 area, which is over in North Minneapolis, was the highest in the country, tested highest in the country for STDs and such. They were the highest in the country.
And this
was
in the late
time.
90s.
Yeah, and I think they either one or two even right now.
Really?
Okay. So there was an illustration that said, if you have unprotected sex with a person, you've just had sex with the last 10 people that they've had sex with.
Yep, I've seen that sign too. There's a sign. There's like one person, then you have sex with one person, and then it like multiplies by like 10, and it just goes down. And I remember saying it as a kid. I'm like, oh my gosh. And not really fully understanding it, but seeing that visual, I was able to understand how easily this thing could spread.
Now, add that to that, that visual for that visual that you were speaking of in terms of transmitting the COVID, to other people. Add that illustration. Take that illustration, just for example, the last 10 people. So now, how many people have you been around? How many people, your own grandmother, your grandfather, okay? So what do we need to do to get this message to young people and to people, period, to let them know that, this thing ain't playing? Now, I will share this with you, something that you had spoke about at the beginning of the show. I was just at my doctor's the other day, Tuesday, and COVID is a pulmonary condition.
Mm-hmm.
I never try to not use the word disease, but I already have a pulmonary condition. It's called sarcoidosis. And a lot of people don't understand what sarcoidosis is unless I tell them that that's what Bernie Mac died from, because he had sarcoidosis. And it's a lung thing. It's like asthma times 5. Mm. And I already have that condition. And he's a pulmonary doctor. And so he was telling me about the different workshops and stuff that he's been to. He's had to treat COVID patients and whatnot and everything, because that's his thing, even before this came. And he was talking about the vaccine. And that's what I wanted to point at you, because you were talking about the vaccine earlier. And he said that right now, one of the big things is about who's going to get it first. Now, I know that we've gotten some instructions not to take this vaccine. We've got this healthy reluctancy, based upon the Tuskegee Airmen experience, and many, many, many other things. Mm-hmm. So it's okay. That's why I call it a healthy reluctancy. However, what he talked about was the biggest thing, and this man's been keeping me alive for years, okay? And it's the only reason why I'm bringing him up here today. He said, it's about who's going to get it first. He said, there are seniors who are in these homes that are not protected and stuff like that, who are vulnerable. He says, people like you, who have 2 pre-existing conditions, whatnot. He says, this way, he says, a man who's rich and who's got some money can't come in there and get it before you just because he got money.
Right, it's a process.
So he said, this is really is going to be the big thing that the state has to really regulate and do their diligence, go to health records and all of that stuff. He said, that's really the thing. And so anyway, after hearing from him, now this is my doctor, and I'm here to say that, it increased my faith in the vaccine itself. That,
this is someone that you trust.
Yeah. This vaccine is going to work for everybody, from what he was saying. The only problem that we're going to have is about who gets it and how it's going to be distributed and to whom. Nobody just because they, it works just like a kidney or a liver. It's a prioritized thing. Or not that you're on a list or anything like that, but when the state does its health assessment of people, if you've ever been to the doctor, they got a record of who you are.
Yeah, and they ask you all those questions.
Mm-hmm. And so, there's Wes. Wes has pre-existing conditions. He's definitely vulnerable. Yeah, we want to definitely get him in here and get him the vaccine and something, because these same young people who are asymptomatic, not having any symptoms, well, what do you think that they'll be on that list?
Probably close to the bottom.
See? So that presents a degree of danger, because if they're asymptomatic, they could have it and not know that they have it.
And there's a term for those types of folks. They call them super spreaders.
That is my point. Where are we? So then, it's just like the testing piece. Okay? Let's say I got a test last Thursday. Okay, so in about 2 weeks or so, maybe I might need to test again.
Yep.
This has now become a process, and people are not understanding. This is becoming a process. You need to know your status on a continuous basis. It's not just, I took the test, I tested negative. No, this ain't no STD test. This ain't, no, it's not that. It's one of those as to where the next day it could be different.
Depending on your interactions with people, or just simply you being outside, going to the grocery store.
Okay.
This virus can thrive on surfaces for up to what? There was a lot of misinformation out there about that, but I think the most recent information I got was like 7 to like 10 days where the actual virus could like thrive on an environment.
Yeah, and think about it. Now, here's the one thing. I know that we all, this is the end of the year. We're all saying, "Oh God, this has been the worst year in life."
Has been a hard year. Has been
All
a
that
hard
and
year.
everything like that. But is there a bright side? Of course, there's a bright side. Let's look at March, where people were going on ventilators and dying. And now, people are testing positive, being quarantined, and coming home from the hospital. Never have to go on the ventilator. That's the degree of progress.